No, I don't want to take that. I want to go by the lab book here. That's the whole stuff we put it in there.
Determine the size of the suction catheter to use. The outer diameter of the suction catheter should not exceed 1/2 the size of the inner diameter of the airway, because the airway is usually measured in millimeters, and suction catheters are usually measured in even number French size. A conversion is necessary. The following is the formula which will result, blah, blah, blah. Okay, so it's 0.5 inner diameter millimeter times 3 plus 2
There we go.
French suction catheter size.
Okay, now, what we're going to do is half of the trach size. The trach size is what? 8. Half is? And times 3 plus 2. 14 French catheters. Okay? Any question about that? Half times 3 plus 2.
That's what I had on last.
This is what I was trying to tell you guys yesterday.
Okay, so that is
Okay.
a 4, you said, you're presenting that's a 4?
No, this is actually 4, but I'm pretending this is 8.
That's, do they think they're there?
Oh yeah, all of our patients are 8s.
Almost 8 for
Yeah.
adults.
I'm talking about, you're talking about the catheter size. I'm talking about the trach size.
Yeah, it's all 8 is the norm.
Oh, see, I'm used to kids.
So it's divided by 2 times 3 plus 2.
Yeah. So if my trach size is number 6, what's my suction catheter size?
3 times 3 is 9 plus 2. 11.
11. We don't have an 11.
So it's a 10.
10 or
Or
12.
12.
Smaller rather than larger.
Well, how do you know? Well, now that's good question. Which one are you going to use, a 10 or 12?
I want to make sure it's going to fit somebody as well.
Well,
Or a larger one's going to suck more.
yeah, the larger one will suck more. The problem is it's going to block the airway.
Yeah.
Okay.
So is a 10 better? If you have an 11?
10 is actually better. When you start suctioning, if you're not getting a lot of secretions, with 10, what do you need to do then?
Then you go to the
The
12.
12. If you have thick secretions and if you can't get the stuff out with the 10, you want to go to the next step, which is 12. This stuff is on the exam, on your NBRT exam. So make sure you understand this, okay? Okay, so if your trach size is number 4, what's suction catheter size?
2 times 3 plus 2.
8.
8. And you can go one step higher, one step below.
But this is an 8, so what did you guys say that should be? So that should be 12 plus 2 is
14. 14.
Okay.
So you can actually use 12 or 14. I've never seen a suction catheter of 16. I think the 14 is the largest that I saw. Okay? So you can actually go down 12 or 14 before the number 8.
That's pediatrics, a whole different world.
Yeah. So this is the main difference with the suctioning the trach. This is extremely important. You have to pay attention to it because when you come to the hospital, if you, you know how many thousand times I go in a patient room, they have a number 4 trach in, and they have a 14 French suction catheter sitting there, and nurses are suctioning them with the 14 French suction catheter. And the patient is bleeding. Yeah, they're sticking a huge suction catheter down to their airway, and they can't even breathe, and you've hurt them. So, that's extremely important. Okay. This suction catheter obviously not going to go through here. What suction catheter is this? Does it say?
No, you can see it, 14.
Anybody see this? 14 French suction catheter. Can I suction with the 14 French for this particular trach?
You said it was
This
a
is
size
a
4? No.
It's not going to go in, but I'm just going to pretend. And call it. All right, now, I got the right size of suction catheter. Well, I got the lube here already. So move it up. I don't know how your steps is gonna go. I'm not gonna follow the steps. I'm just going to basically tell you what you should do, okay? Okay? Keep it up. What you do next, you want the tip inside. Why is that? Yeah, but if you do this number, see what happened? It's already touched. So, I see that all the time. People do. Yeah, dominant. Anything that I'm missing, let me know, okay? Your suction is already turned on, and it's all ready to go. And I showed you that last week how to set up the suction. What's the suction pressure should be? It's an adult. I have it on 100. Right. All right. Wait a minute. If you don't have your ambu bag all set to go, you are really screwed. Because you gotta set this down and go find your ambu bag, right? So that's why you already have your ambu bag turned on, ready to go by the bedside. Now, you are silencing the ventilator for silence. Taking the patient off the ventilator. You are hyper-oxygenating the patient. How long? Okay. At this point, what am I looking?
The monitor for heart rate.
I'm looking at the monitor for the heart rate, respiratory rate, and the saturation, and looking at the patient too. And let's say when you're bagging the patient is coughing against your breath. It continuously coughing while you are breathing. What are you going to do? You just have to go with their breath. Okay? Okay, what you need to do is, you can tell them, take a breath, breathe. Okay, you coach them if they can understand you. Or if they can't, if they're unconscious, just breathe with them. Don't fight against them, okay? All right, you bag them. Now, you're going to take him off. I don't think the catheter will go down, but we'll see. All right, the catheter in. Once I meet the resistance, I do not go down again. Suctioning, suctioning intermittently.
Isn't there,
And hyperoxygenate. Can you turn that on?
isn't there a certain distance you wanted to go, not just meeting resistance, but just,
Well, especially with the neonates
Yeah,
and the
like-
pediatrics,
yeah,
they give you a certain length.
yeah,
With adults, what we tell them is
meet the resistance?
meet the
Okay.
resistance.
Okay. Not that good sleep.
Yeah, if it doesn't work, don't worry about it. Yeah, just turn it off. It's not working. It's not working. It's just a bothersome. Yeah. So, the catheter size is important. When you put in the catheter inside, that's important. As soon as you meet the resistance, you pull back a little bit and start suctioning intermittently. And how many seconds? The 10 seconds. The whole procedure should be less than 15 seconds. Okay? So, as soon as you come out, you start ventilating them. Okay, you ventilate them. At this time, you're looking at the monitor. What happens if they go into some kind of tachycardia, like heart rate of 190? You hyperoxygenate them, continue to hyperoxygenate them until they get better, or you call somebody, or tell the nurse, or call Code Blue, or whatever you have to do.
When you oxygenation, when you suction the first time, so then you put some more oxygen